Many thanks for staying with us here on Joy News today. Now, some environmental health officers in the eastern region are raising concerns about, and they're actually threatening to stop burial of COVID-19 cases. This because they do not have vehicles to transport bodies, so they rely on tricycles. The acting environmental health officer for Denchembo Yao, Aqua Latte, says private health operators have refused to cut COVID-19 bodies.
2020 to this day, 14th August 2021, the Environmental Health and Sanitation Unit, that's the officers behind, have been able to bury 10 bodies. Today, we buried 8 already. Today, Saturday, we are burying 2, making 10. So we have been able to bury successfully 10 COVID-19 bodies. But the first 8 we suffered. Some of my officers were not even wearing Wellington boots. They were walking barefooted. You have the videos here. We can give it to you. And because we were not having laborers, currently we are suggesting to government to recruit laborers for environmental health. Because in 1994, when we were transferred from the Ministry of Health, they only transferred the personnel, the environmental health officers like me sitting here, standing here. That's what they transferred. They left the laborers at the hospital. They left our budget at the hospital. They left our equipment at the hospital. Currently, if you come to my office, there isn't anything like a tool there. Sometimes when we are going for the pauper burial, that's the madman who dies on the street, well decomposed and cold, that's when we improvise to manage or get the funds to buy tools for the office. But as to procurement of tools for the district assembly, no, we don't have a budget. We want government to also expand our scope. We have been a unit for long under the Ministry of Local Government, for that matter, the Local Government Service, under the MMDAs. We should have a department. Currently, as I speak, I am District Environmental Health Officer in the Denchembo District Assembly. When I report to the DCE, the District Chief Executive, and then copy the region. That's the Regional Environmental Health Officer. Now, the Regional Environmental Health Officer is also to collect all the 33 MMDAs in Eastern Region and also write his report to the National Environmental Health Officer, of which we don't have. We don't have the National Environmental Health Officer. So the report from the region goes to the local government service, and there isn't any front desk officer who is environmental health officer to receive such report and technically advise the head of service, who is the head of the local government service on sanitation issues. That we environmental health officers take over from the Ministry of Health, Ghana Health Service, as burial team in the local government service, for that matter, the MMD, Metropolitan Municipal and District Assemblies. Some of the challenges that we are facing are: 1, we lack logistics. When I say logistics, I mean vehicle, motorbikes, even computers, for us to be able to store data on this COVID has been a challenge. Some of us don't even have offices in our sub-district zones. We go there to the communities, engage the communities, and we come home. We come home just like that. This COVID, as you can see, and your comments can take, we use private heads from St. Dominic's Hospital, which shouldn't be so, because the Public Health Act, Section 3, has mandated environmental health officers.
Let's get some more on this. Correspondent Kofi Siao joins us on the line with some more details. Kofi, help us understand. The tricycles they are using, are they privately owned or specially procured for these purposes?
Okay, so according to the district director for Denchembo, who is also the national president of the Environmental Officers Association, the tricycles are privately owned tricycles. They belong to individuals in society. These are not tricycles that were bought by government. So what they are saying is that due to the lack of these health services in the district assembly, the environmental officers are compelled or are forced to rely on these tricycles and mini trucks that belongs to individuals in society. And usually when they are able to hire the services of these trucks or mini tricycles, what happens is that these operators refuse to allow their tricycles to be disinfected. That is what Mr. Akwalate is telling me. And their reason is that they want to take the money directly from them. And so when they go home, they can pour libation, perform some rituals and other things before they can clean their tricycles and use it for other purposes. But as to whether when they are giving these monies, when they go home, as to whether they're going to disinfect it or not, he cannot tell. And he thinks that this can pose some kind of health challenge to the public, because some of these tricycles are the same tricycles that when you go to the market, when you go to the villages, they are used to transport food items from one community to the other. So exposing the food stuff to this COVID-19 virus can be very dangerous to the human health.
Absolutely. But Kofi, help us understand on the part of the health operators, is it that we do not have enough of them in the system, or they are simply refusing to take up COVID-19 bodies? And well, why is that?
Well, what he says is that they have officers in the district, but they are not enough. Okay. One, he says that this environmental officers, the one he calls environmental officers, are supposed to be administrative staff. And the local government ministry is supposed to provide them with additional staff who work as laborers. That is what he says. But when you visit these districts, they do not have the laborers. And he is saying that when the association or the environmental officers were transferred from the Ministry of Health to the Ministry of Local Government, they transferred only the human resource aspect from the Ministry of Health to the Ministry of Local Government, leaving the laborers and other, logistics that they would have needed to work with. So that is what he is saying, that if the government wants their work to be enhanced, what he says is that he should bring back the environmental health officers either to the Ministry of Health so that they can be well equipped and work in accordance with their work ethic.
In all of this, have we heard from the Regional Health Directorate? What have they been saying?
Well, I have been trying to reach the Regional Health Director, Dr. Winfred Ofosu, but he's not responding to any of his calls. So I'll still keep in touch with some or other officials at the Ghana Health Service in the region to find out exactly what they have to say about the issue.
Kofi, do we know what is happening at the end of this, which is the cemeteries? Are the operators there or the caretakers there? Are they also complaining, raising issue with that?
Well, when there were no caretakers at the cemetery, what is happening is that they have a separate cemetery that they used to bury. Okay. When any member of the society dies, but they have a separate one also located for the burial of COVID-19 people. And when there were no, people there who are manning the place, what is happening is that these environmental officers are the same officers who, when there is a burial of a COVID-19, corpse, they move to the cemeteries to conduct the burial.
Very well. Kofi, thank you very much for bringing us those details on this development in the Eastern region. Let's go to the other phone line. We are joined by a virologist with the KCCR, Dr. Michael Osu. Doc, this development certainly must be worrying. Tell us what the implications are.
Good afternoon to you, and good afternoon to all your viewers. So certainly, this must be worrying, because within the context of public health and responding to pandemics of this nature, you wouldn't want this to happen. And this is why there are laid down protocols by WHO and even by the Ghana Health Service in how to manage bodies that are of this kind, and people who have died as a result of pandemics or epidemics. Although we understand that when it comes to COVID-19, the risk of infection from dead bodies is not that very probable. We are also in a crisis where neighboring countries are recording Marburg and Ebola, which is unforgivable. So if this system is not put in place, I mean, you can do this for COVID, and maybe you may go scot-free, but then you will not be forgiven if you carry a dead Marburg or Ebola body of this. You will just trigger an outbreak that will cause massive epidemics across the country. So, I mean, when it comes to handling bodies, even for COVID, the protocol is that you should be able to use, we have body bags that these have to be kept in. There must be dedicated vehicles that have to package these bodies and transported to the appropriate place for them to be buried. Even for those who do that, they must go through high standard protocol and precautions to ensure that even the vehicle that they use must be disinfected with an appropriate disinfectant. So you don't give room for any form of transmission to occur. But in this now is if other tricycles are involved with people who may not be experienced, might not have been trained, and may not have a better understanding of the public health systems. It could pose danger to themselves, but then this could also pose danger to the public. And because at the end of the day, they may also want to carry ordinary people in their tricycles. And you may never know. I mean, people may be infected. But as I said, for COVID, you may have a lead way out, but for Marburg and for Ebola, this is something that we really need to look at. And I will urge, the other units to report this to the Ghana Health Service so that they could look into this and support the environmental health officers so that they'll be able to do what is supposed to be done.
Given the constraints in the eastern region with the lack of HERS operators, would you say that if the infection is done with the tricycles, because the operators of the tricycles are just refusing to have their vans, disinfected, if that is done, would that be safe enough? Would that reduce further the probability of infections?
No. I don't think in the first place we need to involve tricycles in transporting bodies of people who have died through any form of infectious disease. It's not a standard protocol. This is not what is done within the Ghana Health Service. There must be ambulances or other cars that are dedicated for this purpose, and this is what they are supposed to do. So the notion that tricycles will be involved and disinfected is something that is not enshrined within our own standard protocols and guidelines. So I think that this, as much as possible, should not be encouraged, and we should use the appropriate systems established by the Ghana Ministry of Health, the Ghana Health Service, and the Environmental Health Officer. They know, they understand what is supposed to be done, and this is what I think must be encouraged. So left to me, the tricycle concept should not even happen in the first place. We should not allow this to happen so that you serve as another route for transmission of diseases that could pose danger to all of us.
Thank you very much. That's Dr. Michael Ose, a virologist with the Kumasi Center for Collaborative Research. And I must say that we have made attempts to speak to the Ghana Health Service. We do not have anyone readily available to speak to us. Once we do that, we'll bring you their reaction to this development.